Martin Luther King Day, and Obama gets inaugurated into office. I think that's pretty awesome. Thank you all for making it out tonight. I know it's a holiday, which is great. I didn't think we were going to have such a large attendance. Always expected a Mobile Monday. So there's 5 demos tonight. We're going to have them come up here for 5 minutes. And each of these companies probably needs some help from you guys, so they're going to shout out a few things they might need help with, and if you guys want to connect with them after, that'd be great. For all the investors in the room, get your checkbooks out. This year we partnered up with Demo for Demo Mobile. They're doing a mobile track in April. Basically, over the next 3 Mobile Mondays, we're going to have 3 5-team groups, and we're going to pick one of the companies to present at Demo, and they get to present at Demo in what's called a showcase sponsorship for free. So that is basically what everyone's competing for, and the Mobile Monday group will be judging each and every company, and then picking the final one. What would that be? March. Alright, so I'm going to hand it on over to Jeremiah, and he's going to he's going to do the roll call for the 5 different companies. So if you are demoing tonight, please make sure that you are nearby. I know that you guys all did your tech checks and everything. Anyways, I'm going to let him take it away, and then we'll get started on to the panel. Thank you.
Thanks, Ryan. Happy Monday, everybody. Smile, it's Monday. There was a few questions before we start. First of all, huge thank you to Coney and Adobe. So if we could please give them all a round of applause. Fantastic space. Earlier we had an announcement for the W3C Conf, which is up here. There was at least one question. So we were just told that if you register with Adobe, you actually get $100 off. And I was told to remind you to register quickly. They're going quite fast, as you can imagine. It's W3C. So the first demo we're going to have tonight is from jogger, and so they're going to come up here and set up. And I'll set that up for you if you just want to go ahead and introduce.
Thanks. Is this mic on? Can you guys hear me?
Yeah.
Hooked up to the iPad.
Yeah, can you see the display monitor? Love
There we go. Okay. Good enough. Hello all. Thank you for coming out tonight. I'm Ron Packer, the founder of jogger. Before I started this company, I was a doctor for almost 25 years. I got to see firsthand what poor adherence does. If you're diabetic, it means early blindness, kidney failure, amputations, horrible things, hypertension. A lot of the chronic diseases that we're addressing primarily with our app can be dealt with just by taking medicine and paying attention to daily functions that you're supposed to do. Let's get right into the demo, and I can explain a little bit more about that. The way the app works is, in this country, you're signed up at a retailer, like a large pharmacy chain. Your mobile device will be automatically populated with your prescription data. And you will then get reminders that it's time to take your medicine or check your blood sugar and such. We do have a live demo version that's now on the iTunes store for free download. You enter your own information. And but the final product with our first client, it will look somewhat different than this, with different screens for adolescents and for the senior population. But the basic architecture is all the same. You get a reminder, the pill box alerts you that it's time to take the medicine, and you can see exactly what the pills are that you're supposed to take. Now, up to that point, the app is sure to fail, because simple reminders without engaging an individual or without giving them some value in the experience will not be effective. So the way that we got into the behavioral psychology of this endeavor was to, first off, make it very intuitive and easy for the individual to see that they are actually participating well in their care. So we created a graphic interface, which is that bar at the top. And you can see that it's a short red line right now. That grows according to an algorithm that takes into account not only your daily adherence, but are you taking your medicine on time, are you doing so day after day, and are you refilling? And as part of the Affordable Care Act, also known as Obamacare, there are now programs which actually rebate the insurance costs for individuals if they participate in their care. For example, for smoking cessation, you can get as much as 50% off your insurance. And there are calls for other wellness initiatives, including exercise and obesity, and we fall within that rubric. There are employer insurance programs that already exist where if you participate with self-responsibility in taking, say, statins, that you will have a lower, which is for cholesterol and lipids, that you will have lower insurance premiums. So we make it easy for the individual to participate and see. Well, in our program, it's called Get in the Green because that bar turns green at the top. That alone was not enough we felt, to make people motivated to participate. There had to be something of an immediate value to the user to keep participating. This is a screen that says it's time for a refill. We'll pass that. What we do on the platform is curate content to the individual's interests, say sports or movies, music, those sorts of things. In our demo, we just have simple days of the week and different messages that come up. But what our object is to keep it fresh and keep it engaging so people actually don't know what to expect and find it somewhat fun and entertaining to participate. We have some pretty neat 3D graphics that we're working on as well. But this is a real kicker. We want to tap into the brain's reward mechanism, the so-called dopamine pathway. And to do that, you have to give somebody a reward each time that they participate. We purposely didn't tie that reward to taking adherence. That is, whether or not they take their medicines, we trust you. It's up to you to take your medicine. You do need to refill to stay in the program, but we want to say we're big boys and girls. Go ahead and take your medicine when we remind you, but here's an advantage of participating in the program. In the demo, it's just a simple collectible, in this case, a chair prize. But ultimately, working with the retailer that you pick, that you have loyalty program association with, we can make these worthless collectibles, like the bird collection. Those can be coupons worth things that you're likely to buy anyhow. Now, one of our other projects is in the Persian Gulf, and it's a Gulf state where coupons have no value. They tell me that people buy cars, Ferraris with cash. So we had to come up with a different take on things. I can't really get into it because of NDA, but I can say this. We tap into the wish fulfillment mechanism, and our client is very excited about the idea, and hopefully by the end of 2013, we're going to be rolling this out. So I'll stop there, and thank you very much for your attention.
So next up we have Life Cycle.
Close. Life Channel.
Life Channel. We have Dan with Life Channel.
I hope I don't forget to turn it on. Just go for half an hour. Bless you. Good evening. I was first going for the best splash sheet up there. It's a picture of my kid. Yeah, you want to turn that on for me? My name is Dave Lockwood. I'm the CEO of Life Channel. At its simplest, we build mobile guides for disease-specific health journeys. So what exactly does that mean? Whether you've got diabetes, cardiovascular disease, or you just had a little endoscopy, the behavior you're supposed to exhibit during that disease, that health journey, is some combination of eating the right stuff or changing what you eat, activities or activity levels, and some type of prescription drug adherence, along with the people and the support teams that help you make that happen. So what do we do in these mobile experiences? We take evidence-based research, break it into categories that map against the reasons why you do or do not exhibit good behavior, and then chunk it up into 30-second and 3-minute experiences that we deliver in the right order to you to keep you on your health journey. It's a little knowledge for people doing any behavioral engagement. For any of the big reasons why you do or do not exhibit good behavior around health and adherence, there is a category of content that is most likely to get you to change that behavior. Also, engagement of support teams. For every disease that we're engaged with right now, we've mapped out the milestones and inflection points of that disease, and if you tell me 5 people that are on your support team, I engage them against those milestones and inflection points. So, if you told me you're quitting smoking, there's 11 milestones and inflection points. At the beginning of the program, I solicit your support team and say, there's going to be a day when Bob is struggling with quitting. What message do you want to send him on that day? And then as the patient progresses through the health journey and triggers that message, they'll receive it. Here's one for they decided to start go through a diabetes program. So how does that all come together? It's day 42 of your diabetes program. If things are going great, you're just going to get a little message that says, how much activity did you do this week? Because things are going great, I'm going to collect a little data. If things are going just okay, I'm going to give you some tools about what to do the next time you go to the grocery store, because that makes you feel more empowered about your disease. If things are going terribly, a month ago, when my wife was engaged to be part of my support team, I said, what would you say to your husband on a day where he's falling behind on his increasing his activity level? And she uploaded a picture of my kid and said, let's go to the park. So the right message for me on that day, depending on where I am. And maybe I need a coupon instead. Traction. We have 8 live programs all running on the same platform. 2 in diabetes, heart, COPD, smoking, discharge, RA, and early stage depression. We ran a pilot with Healthline, Yahoo.com, Drugs.com, and Pfizer on one of them to prove out the model, and we're just kicking off 2 for diabetes with a large payer and a large drug company. We also just finished a paid integration to the largest EHR in the US, where it's going to be built into the doctor experience to exchange information with our app around diabetes and heart disease. From the audience, any senior tech dude finds this interesting, or if you have a mobile health experience around good wellness behavior you think should be part of diabetes, COPD, or heart, and you think you should be a component of that experience, come up and see me. And the 30-second demo is, you come to our experience kind of with, that was a great AV guy. With so this is the app, with kind of 4 things in mind. If I've got 3 minutes today, then I'm making my way through lesson 17 of the diabetes prevention program, which is about getting better at eating out. So, looks like there's a video here that we sourced from the American Diabetes Association, who developed it with us. If I've only got 30 seconds, then either I got a message today, it looks like my mom sent me a recipe, diabetes recipe for that, or the message from the platform today is, let's get out and, here's a song I'm going to play for you, walk for 5 minutes. It's got all the basic, record your blood sugar, reminders of pharma, and then the final thing is, every person's path to health is a little bit different. So we've also enabled the ability to incorporate third-party, let's add a program, third-party programs into the information. So for your Weight Watchers. So let's say, sounds like I'm over. Let's say I'm on Weight Watchers, which fits in line with my diabetes. I can add them to the experience, and when this finishes, as it sounds like the music started here, it integrates all the content of the Weight Watchers program into my experience, my patient experience. And that, oh, and there it is on the main page. And that's it. Curing people, one platform, get healthy.
And next up, we got Neil from Labdoor. He's going to give us a little demo of his iPad app.
Hey guys, hear it?
Turn it on.
Now?
Yes.
Awesome. Hi, I'm Neil, CEO of Labdoor. We use science to tell you what's really in your consumer products, starting with supplements. So what's wrong with the supplement industry? Asterisks. They are everywhere. We don't let other industries get away with this. Do we? So why does a $30 billion industry like supplements go unregulated? Last year, I sold my FDA-registered lab to tackle this problem with a consumer-facing solution. Since then, our team has tested hundreds of popular products. Wouldn't you like to know what's in your kids' gummy vitamins? Or maybe your Centrum pills? How safe really is that case of 5 Energy sitting in your favorite startup's office? At Labdoor, we've invented a better way to deliver you the information you need. Simply scan a barcode or search a product name to get an instant A through F grade based on the safety and efficacy of a product. If you want to do your own research, we built an enhanced product label behind every report. And while our grades are 100% scientific, we've also built in social mechanisms such as user reviews, so that to keep the product conversation going. In our industry, data is everything. And while the FDA does not test final supplement products, we do. And here's what we found. Over 70% of the products tested had inaccurate label data, and over 90% contained pesticides or heavy metal contamination. All consumers need this information. And so we won't just stop at supplements. Our scientific and reporting tools used in the supplement industry can also be used for over 180 billion in products in other industries. So the big question, how does this make money? We've already started building a ad-supported user base, which will be supplemented with premium subscriptions for high-information consumers, as well as custom data analytics for professional users. This is a very similar model that has been used successfully in other major industries of this size to build multi-billion-dollar companies. We believe we have the perfect team to make this vision into reality, both with years of experience building products for millions of users and founding successful startups from day one. Making science beautiful. So we got a couple next steps. Big news, we're launching our web and mobile applications for the first time to the public this Thursday, January 24th. So be sure to check out news sources and our site, labdoor.com, and the iOS App Store for that. As well as we're about to ramp up a seed stage fundraising round. So if that's something that you may be interested in, either grab me after this event, email me at neil@labdoor.com, or follow Labdoor on AngelList. Thank you.
Awesome, thank you, Neil. Next up, Fugly. Thank you, everybody.
like this. All right, yeah. Well, my name is Fugly and I'm the marketing director at Ring It Up. I am filling in here today as something of a second string. Our CEO was stuck on a flight, not able to make it. So, as bad as I do, I can't do any worse than Tom Brady did last night. So, I want to talk just a little bit for a second about what it is that we're doing. So, we're trying to fix healthcare communication. So, the way that if you ever try to call a doctor, it's a pain in the ass with them on the phone. It's if you call after hours, you have to talk to some operator somewhere in Kansas, tell them your story, you've got a sick kid, you don't know what to do. It's just a really impersonal system, and it's something that doctors really hate as well, because on the other end of that, they're getting paged by this guy who's going to be interrupting their dinner, interrupting their kid's recital, just interrupting their life until they get the doctor on the phone. So we have built an app that is allowing doctors to take some of that control back. At the end of the day, the doctor will forward their phones to Ring It Up, and then the Ring It Up system will take over for all of their calls. When a patient calls into the Ring It Up, when a patient calls their doctor's office, they are given a couple of questions to triage their issue. But if their issue is urgent, and they indicate that it is urgent, they're asked to record a couple of questions. Answers to a few questions rather, and then the doctor gets a notification on their phone. We're having a hard time getting the sound to work, so I'm not going to actually call in. But you get here on the Ring It Up app, the doctor gets a notification. The doctor gets a push notification that they have a message waiting. They say we've got some new messages. I have a message here. It tells me I have a message. I can easily play the message as the doctor, understand what's going on with the patient, and then decide to either call the patient back or to, this is something that the doctors are crazy about, is send the patient a message. So Tom Brady just calls in and says that he's choking. The doctor says better luck next year. And sends a message back, and then goes about the rest of her evening. This is something that represents very much the first step of what we're doing and what we're ready to demo here tonight. Future iterations of this are going to integrate patients' health records. They're going to integrate teleconferencing, so if the doctor wants to teleconference back. There's going to be, along with that, applications for patients, so that you can give your patient an app in order to get in touch with you and to better control that communication channel. You can give your patient an app that will allow the patient to call any doctor for sort of immediate consultation. Let's say that I just have an ear infection, I don't want to wait a day for my doctor to call me back. I can pay a fee and be connected right away to a doctor. We're doing that right now in very much pilot stage in California, not through an app, just through a phone system. And in terms of what we're looking for here, we are just about to close out a round. If you're interested in participating or learning more about that, you can find me or you can follow us on AngelList. We are looking for developers. I understand that there are developers in the audience. We are very much looking for iOS and Android developers. And third, we are looking to partner with other mobile companies who are working in the health space and might provide complementary services. So if any of this strikes your fancy, come and find me after the fact, and thank you.
Thank you both. And last up, we have Ari with Better Doctor.
Wow. Hi, my name is Ari Tulla. I'm quite a veteran on Mobile Monday events. I think this must be my 20th event or so in Europe, in Finland, in multiple different countries. I spent the last quite a few years at Nokia, and now last year and a half with Better Doctor. Why move from mobile apps, mobile games into healthcare? We had some family medical issues over many years and found out that finding a doctor is pretty hard here in the US. It's hard elsewhere, but it is bloody hard here. I don't know if you have felt it, but how many of you think that finding a new doctor is really easy? one person. Thank you. So let me show you briefly how this app works. So Better Doctor, we launched the service about 3 months ago. We have had about a couple 100,000 users who find the doctor from our website already. Now we have a mobile app that we're going to launch in about a week. You can already download the app. There are still some kinks out there, so don't be fearful. The final app will be great. So, first of all, we simplify the way how you find a doctor. So based on your medical need, your insurance plan, and your location, you find a list of doctors that we have verified. So what we do there, we have spent the last 18 months of building a database on every doctor in the US. That's about 900,000 doctors altogether. Today on the app, we have 600,000 doctors live. We've been looking at their background information, education experience, malpractice issues, consumer reviews, and of course the insurance plans that they accept. And of course we give you already some candy on the app, so it's a fairly simple discovery tool today, but you can also save your doctors for future need. You can find them on the web and on the mobile. And as I said already, we are also available on the web. And how this works, so we just select what kind of a doctor we are looking for. We are selecting general practitioner here, location, let's use the current location, and then we can select an insurance plan. I have the Blue Cross Blue Card PPO, and then we find a list of doctors. And this search for you, if you do it yourself, might take a few hours to a few days. Then we can look at let's look at Mark, for example. We see the consumer reviews, we can call the doctor, we can save him to the favorites, we can read bio and other information about the doctor. And of course we can also see where they are located. So this is the very beginning of Better Doctor. There's a lot to come in the future. We have an interesting team of 8 people, a lot of people with background on mobile. We are a very tech company compared to many other players in the health space that are more about the healthcare or from the sales. We really are a tech company focusing on the big data. If you are a developer, focus on mobile, Android, iPhone, I'm happy to talk to you. We're also looking at some people on the back end. And we have a plan of ramping the team pretty big in next year. Today, 8 people, the plan is to be maybe 25 people end of the year. So, thank you.
Hello. Let me get this all plugged in here.
So, I really must ask you a question. I guess I'll just shave it for later.